Hi class, this is our 2024 summer edition of Hot Topics, meaning what information, what news is going on for the health IT world as it relates to some of the topics we studied in class this semester. First up, there's been some updates to the interoperability regulations. The proposed rules coming out from ONC is called HTI-2. And it's really an amendment or an update to the regulations as enacted by the 21st Century Cures Act. This HTI-2 proposes several things. First off, there are some new certification processes for healthcare software for the EHR type of products in both public health providers as well as for payers to help with interoperability. So the products used in that space will now have to undergo certification, so that way purchasers of the products can be assured that the data will be exchanged within compliance with the 21st Century Cures Act. There's also been some updates to standards for medical imagery exchanging, a lot of updates to the US CDI. Well, the rule of law now is for providers and software vendors to implement version 4 of the standard. I've got a whole list of notes, so I'm going to be looking at my notes much less than the camera, I should say. But there's been a lot of new details added to existing classes to help continue to improve the amount of information shared between providers for patient records. The new classes, some new classes were added, like for the facility where the treatments took place, allergies and intolerances, not medical, but other intolerances are also part of the medical record that is required to be shared now. Encounter IDs as it relates to the EHR where the data was created are also included, so they can be traced back to the EHR providing that data. There's been a new goals section that has been added to include what the patient's preferences are in terms of treatment intervention as well as care preferences. So we're helping to improve what the patients are expecting as part of the treatment plans. There's also been some data elements added for health status that focus on alcohol and substance use, physical activity, as well as bringing this SDOH data into the exchange or the customer preference, patient preference area. So that's important as well. And then lastly, the laboratory data object has been updated as well to correct really something that should have been there for a long time, the unit of measure, which would be important. What does this number mean? That's particularly important when it could be kilograms or pounds or milliliters or cc's, as you might expect. But there's also information about what the physicians would expect, what result ranges are expected, and what's the interpretation of those results. And then some information about specimen sampling, where the site was, and information along those lines. Lots of new additional information like tracking the average blood pressure, which is important for validating who the patient is, as well as the trajectory of their health. Updating the medical device class so they can better track what devices are implanted in patients and so forth. And lastly, one of the changes is the updating of the exceptions that allow info blocking. And these exceptions involve denying sharing medical records when there's some risk of errors or problems, I should say, legal repercussions or exposure for the provider sharing the information. And so when that might be the case, providers have a reason or rationale to deny sharing the records electronically. On the topic of generative AI, it seems that there's a lot of legal trouble ahead because of the use of data without permission. A bit of an ethical quandary, misstep, or perhaps just blatant ignoring ownership of data. There are lawsuits now coming to OpenAI and Microsoft and other generative AI providers that they have used owners of intellectual property and violated copyright laws. And so New York Times and other smaller newspapers have begun to fight back and say, you cannot use our data you scraped off the web without an agreement in place because it's our information. And those cases are starting to make their ways to the court right now. So in terms of generative AI, the case is still out as to whether or not it's going to be able to proceed in its current form, or if they have to be retrained without ownership, without coming to terms with the owners of that data. There's 3 general areas where copyright laws are being asserted. One is in just the copying of the information off the web and incorporating it into the training. The second is how some generative AI answers will closely resemble the data that it was trained on. And then thirdly, when you ask the tools like ChatGPT to say, what does the New York Times say about an article? It'll pretty much regurgitate the article in very close form and thereby reproducing the article essentially without permission. There's also an ethical issue in that the traffic that generative AI systems are taking away from sites like New York Times and others are prevent them from receiving revenue. So this is not without a cost, because once someone gets the answer from Gen AI, they're not necessarily going to go to the New York Times website and then see the ads that are on there. So there is an economic cost in addition to the ethical violations as well. There's been some other news attention in terms of algorithm bias. Spring of 2024, timestamp it. It was noted in several news outlets that algorithm for determining the sickness level of people waiting for kidney transplants was indeed flawed. And in fact, many black patients, African-American patients, up to 14,000 of them, over 14,000 I believe, were given much longer wait times for kidneys because of how their body functions were evaluated. There's a test called EGR that will measure the level of creatine in the blood and body, and that the issue is that turned out that the algorithms were adjusting those values because there was some false belief that because African Americans may have more muscle mass, their body would produce more creatine, so therefore we have to adjust the levels to make the algorithm or the allocation of kidneys fair. However, it did anything but, because as we know now through the study of human genetics, genome studies, that the difference between races genetically is really, really small. So much so that using race in determination of healthcare policy and allocation of services is not a good idea, as we talked about in class. So that was recently changed, and some of the patients have been bumped up 3, 4, 5 years sooner to get kidney transplants as a result of trying to get them into their rightful place. The last topic I want to talk about for our update for this semester is something of note we talked about in the algorithm biases as well. And we see it in real world as we speak. Again, late spring of this year, 2024, Meta, the company that owns Facebook, announced the creation of an AI council of external parties to help it navigate the use of artificial intelligence in business. That's a really nice idea. Get outsiders to help guide your policies. However, the committee was composed of all white men. Go figure. Everyone looks like Mark Zuckerberg, I guess. The press was having a field day with this announcement because it's so tone deaf, so blind to the fact that people of different races have issues with AI and biases and genders. TechNet article published that 96% of those involved in fake pornography, where their images were used to make AI-generated pornography, were women. And so that's an issue that I don't think the members of the council would have much experience with or sensitivity to, as compared to someone who's female and may know somebody who has had that happen or have the fear of that happening, say like after a bad breakup or something to that effect. In fact, you may remember Taylor Swift, this happened to her a few months back, where her image was used in the creation of pornography, and it was a big problem, embarrassing as well as false. And it's a good example how even today, with awareness of AI biases, algorithm biases, I should say, that the situation continues where people are not being properly inclusive when selecting members of councils or technology groups that have an impact on how technology is used. Always best to include a diversified group of humans when we're considering anything when it involves technology. So that's it for the update for this semester. Hope the class was informative, and I appreciate your attention. Take care.